This is Shane McDonald. Our client's name is Justin Ryan. He came in with his parents seeking help from addiction, methamphetamines. He's 23 years old. He's a male. Currently employed as a maintenance man at an apartment complex. He just moved back in with his parents because he just got out of jail. He's been in and out of jail for a variety of misdemeanors over the last 3 years. Mostly unpaid traffic tickets, a couple assaults, and a few thefts. I asked Mr. McDonald to fill out a SASE 3 substance abuse screening inventory, 3rd edition. I use this because of the validity scale and its effectiveness of pointing out if someone is trying to hide their substance abuse. I did this because Mr. Ryan came in with his parents as opposed to coming in and seeking help by himself. But while filling out this form, Mr. Ryan did list that he used methamphetamines and alcohol frequently over the past 3 years, that his substance abuse is directly related to his periods of incarceration, his inability to maintain employment, family disputes, his social impacts are directly related to drugs and alcohol, he reported, and they're mostly manifest by his manipulation of females. He does this to get drugs and alcohol and a place to stay at times. Of his male friends, he reports that he doesn't have any male friends except for ones that are meth dealers. So, in the diagnosis, the DSM-4, substance abuse, the criteria: a pattern of substance use leading to significant impairment or distress as manifest by one or more of the following during the past 12-month period. Well, he qualifies in all 4 of them without me reading them. And as far as the criteria for substance dependence or significant impairment or distress as manifest by 3 or more of the following during the past 12-month period. Out of the 7 that are listed in the criteria, Mr. Ryan qualifies in all 7. The client's strengths. Client's strengths are that he is very intelligent, he's very smart. This is evident with his pattern of manipulation. Another strength he has is that he seems aware of his substance abuse and that it's causing a lot of problems in his life, and they're directly related to his use of alcohol and drugs. Treatment has a more increased value because of this acceptance. And because of his intelligence and acceptance, a variety of treatments are available to us. Environmentally speaking, on positives, he is living with his parents and they are very active in AA and recovery. This would seemingly enhance his chances of recovery. Weaknesses: the client is very intelligent, he's very smart, very manipulative, has a very big ego. He may very well manipulate himself into believing anything for a very short period of time. The client has not shown the ability to follow through or complete tasks that make his self-functioning positive. His employment, his relationships, neither has he had for longer than a month in the last 3 years because of his drug and alcohol use. Mr. Ryan also has very unrealistic goals for himself. Aspirations are way too high. They're out of his structure of what he's capable of doing. You combine this with his bad ego, or his large ego, and this equals that his goals are never achievable. He doesn't have any realistic goals. Our client is currently sober. He's been sober for 90 days. 90 days he's been sober. The treatment suggestions for Mr. Ryan: cognitive behavioral therapy. Cognitive behavioral therapy can help addicts overcome substance use, teaching them to recognize and avoid destructive thoughts and behaviors. It teaches the patient to recognize the triggers that cause his or her cravings for drugs or alcohol, and it'll teach him to avoid and manage those triggers. We're going to utilize cognitive behavior therapy along with motivational interviewing. We're going to combine these two. It'll increase his chances of recovery. This therapy technique involves structured conversations that help patients increase their motivation to overcome substance abuse by helping them recognize the differences between how they are living right now and how they wish to live in the future. This is important because of Mr. Ryan's goal setting and that it's not realistic. Another form of treatment that I thought about was contingency management. Using this method can provide tangible incentives to encourage patients to stay off drugs. Those rewards might include offering cash, clinical privileges, giving him vouchers for restaurants or for a movie theater if he has a clean drug test. And the reason I don't want to use this with Mr. Ryan is because of his manipulative behavior. I believe that contingency management will only help increase and feed his desire to manipulate things. But giving him incentives and things like that, he'll bob and weave in and out and do what he needs to do just to get the achievement of the reward without actually addressing the problems that persist in his life. And cognitive behavior therapy combined with motivational interviewing will help him address the problems that he has and the way that his thinking is directly related to the problems that he has in his life. Now, homework. Wasn't sure if you wanted us to mention homework, but what I have is from the Hazelden Foundation. It's Cognitive Behavior Care Aftercare Treatment. Session 8. His homework is stress and emotional well-being. And on the homework, this addresses how stress is directly related to his emotional well-being. It points out his strengths, and it also makes him aware of his weaknesses. It talks about his goals and helps him set goals that are achievable. And it talks about how he sees himself within his goals. So this will help him on his journey to achieve his goals. Also, I put in session 9, which is skills for reducing stress. What this does is talk about how stress is directly related to his behavior and how his behavior can help overcome stress and manage stress. So this is what we're going to do, and this is my suggestion, rather, for Mr. Ryan. And my name's Shane McDonald, and this is for Psychology 249, Ms. Rodriguez. Thank you for coming.